Hello everyone, you're all welcome. I'm so excited to be here, and you're all welcome to Pregnancy and Women Health Matters on Ablaze TV. So it's always my pleasure to be back. So today we're going to be talking about the menstrual cycle. How can you calculate your menstrual cycle? How can you calculate your ovulation day, your fertile days, your unsafe days, and your safe days? It is very important. I'm sure many of us are so excited about this topic. So don't miss out on this show today. So we'll start with menstruation. What is it? What is it all about? The menstrual cycle. What is menstruation? How does it come about? And why is it important for us to talk about the menstrual cycle? So we'll start from the beginning. What's menstruation? Menstruation is the shedding off of blood from the inner lining of the uterus, that's of the womb. What happens before menstruation occurs? Normally, a woman has to ovulate. Thus, we have the ovulation. So when ovulation has occurred, the inner lining of the uterus gets thick. It starts increasing. Once it is increasing, what happens? It means that it is increasing, waiting, because once there's ovulation means that you can get pregnant. And when ovulation has occurred and you don't get pregnant, this inner lining, which has been getting thick, it is ready for the fertilized egg to come and implant into the womb. But if fertilization does not occur, you don't get pregnant, this egg will die. This egg has to die. So once it dies, this inner lining, which has been thick and waiting for a baby to come and implant there, is going to die too. It's going to shed off. So it's going to break. So this blood that we see is this breakage from the inner lining of the womb. That is what we call menstruation. Now, the cycle of menstruation, primarily it is divided into two. Sometimes people divide into four, including the bleeding phase and the ovulation phase and maybe the other phases. But now it is primarily divided into two. We have the follicular phase and the luteal phase. The follicular phase, what happens? When menstruation wants to happen, the first thing is we have the follicle stimulating hormone. These are hormones which are produced in the brain. The follicle stimulating hormone is going to stimulate the ovaries where the eggs are being formed. So this follicle stimulating hormone stimulates the ovaries. It produces an egg which is mature. So there are a lot of eggs during that time because with the help of the hormone called estrogen, it helps to mature these eggs. And many of the eggs are being matured at once, but only one is going to be released, the one which will finally be matured to the level of ovulation. That's what is going to be released in the process called ovulation. So that is the follicular phase. The follicular phase means the ovaries are being matured before ovulation. And now, when it is getting mature during the time, the follicle stimulating hormone is rising, the estrogen level is rising. So once this egg has gotten mature and it is ready for ovulation, this hormone called the luteinizing hormone is being released. And when it is being released, it causes this egg to be released out of the ovaries into the fallopian tube. And when it is in the fallopian tube, that is where the sperms come and fertilize the egg. If you had intercourse during this fertile period, maybe before ovulation, few days before ovulation day, it means that the sperms have already come and it is waiting at the level of that fallopian tube for the egg to be released. So once the egg is released, the sperm which is present at that moment can then fertilize this egg. But now, if fertilization does not occur, this egg is going to remain at the level of the fallopian tube. You stay there, and it has 12 hours to 24 hours to stay. So after that, the egg starts to degenerate. It starts dying. So finally, when it dies, because during that time, as it is when the egg is ready for fertilization, the other hormone called progesterone is also being released. This is the hormone which helps in the thickening of the inner layer of the uterus, that's the womb. So once this progesterone is being increased, estrogen is being increased, the luteinizing hormones are high. So when this egg has not been fertilized, what happens? As it starts dying, the level of this follicle stimulating hormone, progesterone, estrogen, they tend to start dropping. As they start dropping, that thickening of the inner layer of the uterus, it starts to break. Then we start seeing our menses. So this stage from the ovulation to when we start seeing our menses, that is what we call the luteal phase. So that is the menstrual cycle in simple terms. It has the follicular phase where the egg starts getting mature. Then ovulation. Once ovulation occurs, we have the luteal phase. Then once the menses starts falling and you start seeing your menses, that is the beginning of the next cycle. So once it has fallen, it means that this mature egg, which was in the fallopian tube, has died. So we need another egg to be ovulated. So the follicle stimulating hormone starts increasing back and starts working on the other eggs and starts making them to get mature, getting back to the follicular phase. So that is how the whole cycle goes. So now, how do you calculate your menstrual cycle? This is something which many women don't know how to calculate their cycle. They always assume, because we know the common days, the common menstrual cycle, the average number of the menstrual cycle is 28 days. And many women out there tend to think that or believe that their cycle is 28 days. Whereas that is not the case. So how do you calculate your menstrual cycle? Every woman out there, you need to know how to calculate this, because once you get this wrongly, every other thing, in order to calculate your fertile period, your ovulation day, everything is wrong. So you have to get me clearly. In order to calculate your cycle, like we said, it is from when you start bleeding to the next bleeding. So if a woman starts bleeding, for example, on the 1st of January and sees the next menses on the 28th of this month, that means this woman has a 27-day cycle, because this 28th day, when it starts bleeding, it is the beginning of the next menses. What do I mean? It means your menses starts from the day you start bleeding. You consider it as day 1. And with day 1, you start counting. Once you see your menses the day before, it is not your cycle. Like I said, the example 1, when you start bleeding on the 1st of this month, and you see your menses, for example, on the 29th of that month, then it means you have a 28-day cycle. I hope that is clear. If you have any questions, you should drop them on the comment section. So now that is how you calculate your cycle. So some people who have a regular cycle, that means you have a cycle ranging from 21 days to 35 days. If your cycle lasts for 21 days or up to 35 days, it is within the normal range. That's what we call people with regular cycle. So if your cycle comes every month, every after 21 days, or someone every after 35 days, it is very, very okay. So it must not be that 28 days. So you calculate for the past 3 months and know your own cycle. So if you take for January and you have your menses, you calculate when it started and when the next one started. You take for February, So you take for 3 months. Once you've taken for these 3 months, then you'll be able to know your cycle. If it's someone who has a 25-day cycle, and this month you see it 25 days, the next time is 26, the next time is, you can say, 25. So in this case, you have an average of a 25-day cycle. So normally we know the human system, it cannot really be exact. So if you see it 1 or 2 days before or after, it is still very okay. It is very normal. But once you start having a cycle which ranges more than 3, more than 4 days, or sometimes 5 days, that is where we start talking of an irregular cycle. So with an irregular cycle, it happens when, first thing is, it is less than 21 days. I said the normal cycle is from 21 days, and it can even go up to 35 days. If you have a cycle less than 21 days and above 35 days, it means you have an irregular cycle. And if you have a cycle even within these 21 days, but the variations are large, for example 25 days, the next time it goes to 30, the next time it goes to 22, so this variation is too large, you have an irregular cycle. So in order to know your own cycle, you have to calculate this for the past 6 months. You will no longer take 3 months as someone who has a regular cycle in order to know your cycle. Because the problem with these people who have irregular cycles is because there are some times which they don't ovulate. Someone who has a regular cycle, you can ovulate, you have a chance of ovulating for 12 times in a year. But people with irregular cycle, they might ovulate less than even 10 times, even up to 8 times. So that is the problem with people with irregular cycle. So it is very important you know if you have irregular cycles. I'm going to teach you how to calculate your fertile period and your unfertile period in people even with irregular cycles. So now, is it possible for you to see your menses in the same month? Now we'll go to the misconception, we'll go to the mistakes women make while calculating their cycle. First thing is, women will say, we can ask you, how long is your cycle? You say it's 3 days, it's 4 days. But you are talking about the period of flow. That is not your menstrual cycle. And the period of flow, even you flow 5 days, 3 days, 7 days, it does not matter to us when it comes to calculating your fertile days. We just need to know the day it began. That is all. Even you flow for 2 days, it does not matter. What happens is, if it's regular, if it goes all through your cycle, that you flow 2 days or 7 days and you have no problem, then that is normal for you. But we don't want to hear you saying that your cycle is 3 or 4 days. Your cycle is when you start seeing your menses to the next day, to the next cycle, to the next time you start seeing the next menses. Now, in order to know the second mistake we make is, everybody assumes that the cycle is 28 days. Like I've already said here, it is different. Then others assume that the ovulation day is on day 14. We're going to come to that. And it is not on day 14 for everybody. Others know that they cannot get pregnant if they have intercourse, unprotected intercourse, during their period. That's when they are bleeding. But you will see that you are wrong, that you can even get pregnant if you had sex during the time that you are bleeding. It is possible. It is very possible. So we'll get to that. So we're going to take a short break. Again and again. Again and again. So now, how do you calculate your safe days and your unsafe days in someone with a regular cycle? Someone who has a regular cycle, the first thing is, once you know your cycle, I can say once you know your cycle, that's the best thing that you've ever done. That's the best thing you've done. So don't even, because once you don't know your cycle, you cannot even calculate any other thing. So now, once you know your cycle, in someone who has a 28 days, I'll go back to the menstrual cycle. What happens is, the first phase, I said we had the follicular phase and the luteal phase. This follicular phase, Where the difference comes in people who have a 30-day cycle, 28-day cycle, the difference comes in there at the level of the follicular phase. This is where the variation occurs. The luteal phase, once ovulation has occurred, it takes 14 days for the next menses to come. So if your ovulation occurs today, if you're sure that you can do the test, because there's a test for ovulation to see if you're ovulating. Once you do the test and you say, I am ovulating today, in the next 14 days, you should be seeing your menses. So the variation comes in the follicular phase where these eggs are being mature. That's where the difference comes in. So in order to know your safe day or your ovulation day, if you have a 28-day cycle, how do you know your ovulation day? You take 28 minus 14. It's going to give you 14. And 14 days before, 14 days after. That's 28 days. That's why many people assume that the cycle is on the ovulation day is on day 14, because they are assuming the average number of the average cycle every woman has, but it is not your case. So you calculate your own. So in a woman who has a 30-day cycle, how will you know your ovulation day? You take 30 minus 14, is going to give you 16. So you see that your ovulation day is on day 16 of your cycle. It is not on day 14. So if women out there who have their husbands in different towns, who are abroad, and a man wants to just come and make sure that during this time before he leaves, you should get pregnant, and you say my ovulation day is on day 14, when your ovulation day is still coming, then you plan on that 14, and maybe, well, it can happen, but you have missed the ovulation day. So once you calculate 14 minus you take your cycle minus 14, so you have 16 in someone with 30-day cycle. That is your ovulation day. Now, to know the period, your fertile period, the time that if you have intercourse, you're going to get pregnant, you take that ovulation day, you say 5 days before, you take 5 days before that day and 2 days after that ovulation day. What do I mean? If you have a cycle, 28-day cycle, 28 minus 14 is going to give you 14. So 5 days before is going to give you 9. So from day 9 to day 2 days after 14, that's 16. So from day 9 to day 16 is your fertile period. So if you have intercourse within this period, you can get pregnant. Why? Because the sperm stays in a woman for at least 5 days. Sometimes it can take up to 7 days. So if you have intercourse 5 days before, that sperm can stay inside you till that ovulation day. So you give 5 days before and 2 days after. So within that period, you can get pregnant. Then the other days before, you are safe. So if you want to be safe, from day 9, you should avoid intercourse, unprotected intercourse, till after day 16. From that time, from after day 16 to the next menses, you are safe. Now, in someone who has a 30-day cycle, you see, take 30 minus 14 is going to give you 16. 5 days before and 2 days after is your fertile period. That's how you calculate. Let's take someone with a lesser day. You have a 21-day cycle. 21 minus 14 is going to give you 7. It's going to give you 7. So your ovulation day is on day 7. Take 5 days before is day 2. That means you see your menses today, you are flowing today. The next day, you are already in your fertile period. So the next day, you are still bleeding. If you have intercourse, you will not get pregnant, because that sperm is going to stay inside you till that ovulation day, which is on day 7. So those are the scenarios in which you can get pregnant even when you are bleeding. So don't assume that, no, I am bleeding, I am on my menses, I can never get pregnant, when you have not even calculated your cycle. If you have a short cycle, you have the risks of getting pregnant during that time. So that is how you calculate your ovulation day, your safe days, and your unsafe days. That is in someone who has a regular cycle. So once more, you're welcome to Ablaze. You're welcome to Pregnancy and Other Women and Other Health.
This is not.
Yeah. Okay. So okay, sure. So once again, this is Pregnancy and Women Health Matters on Ablaze TV. We are always ready for you to give you tell you things about pregnancy and women health issues. So today we are talking about the menstrual cycle. Do you know how to calculate your menstrual cycle? Do you know how to calculate your ovulation day, your safe days and your unsafe days? This is what we are talking about. So we are talking about, now we are going to be talking about how to calculate your safe days and your unsafe days in someone who has an irregular menses. And with this irregular menses, this is where people have difficulties to conceive. You can see someone who has struggled trying to conceive for years, especially people who don't live together with their partners. They have difficulties trying to conceive because you don't know when the ovulation is occurring, because it's not every month too that you ovulate. Now, how do you calculate this? The first thing we need to do, like I said, you calculate your cycle for the past 6 months. You have at least 6 cycles that you have to use. You see that this month it could be 21, it could be 28, the next time 33, or the next time 40. So with all this, you can be able to have an average of how to calculate your cycle. Let's take an example of someone who has 21 days, 30 days, 28, 25. So how do you calculate your cycle in this case? You take the smallest number and you take the smallest circle and you subtract 18 from it, and you take the longest circle and you subtract 11. What do I mean? I said the example of 21 days. For that example I gave, the smallest was 21 days. So you take 21 minus 18. So in people who have an irregular cycle, like I gave the example, the smallest circle was 21. So with 21, you take 21 minus 18. This 18, that's standard values. So you take the smallest circle minus 18 and the longest circle minus 11. These are standard values. So in the example we gave, we said 21 was the shortest circle and 30 was the longest circle. So we take 21 minus 18 is going to give you 3, and 30 minus 18 is going to give you 9. 30 minus 11 is going to give you 19. So it means that your fertile period is from day 3 to day 19. You see that here you have a longer period for your unsafe, you have a longer days for your unsafe period. So now, how can you know your ovulation day from this? It is usually closer to the shortest cycle. So if you take that 21 minus 18, is going to give you 3. So you usually count 5 days. 5 days after that day 3, it usually gives your ovulation day. So within that period, you need to make sure that you have intercourse if you want to get pregnant. And in those who don't want to get pregnant, within that time, you need to avoid unprotected intercourse. So I hope this is clear. You calculate your cycle for the past 6 months. I have already spoken on how you can calculate your cycle correctly. You see that once you have calculated this wrongly, everything goes wrong. So you take 21, you take your shortest cycle from the 6 cycles you have calculated for the past 6 months. You take the shortest cycle minus 18 and the longest cycle minus 11. Those days in between are your unsafe period. So I hope this is clear. If you have any questions, you can get to me back or on the comment section. So now, can someone see the menses twice in a month? Is it possible? Yes, it is possible. If you have a 21-day cycle, if you have a 28-day cycle, it is very possible. You see your menses on the 1st of this month, and the next, it's still in that month, on day 29, you should be seeing the next menses if you have a 28-day cycle. Is it possible to skip 1 month and you don't see your menses? Yes, it is possible. Someone who has a 33-day cycle or a 35-day cycle, if you see your cycle on the 31st of a month, that next month will pass. Even if it's a 31-day cycle, it will pass that 31 days, and you will even still see around the 4th or 5th of the next month. So it is very possible. So if you have missed that January, you should not be scared. If you know your cycle, my cycle is 35 days. If you know that that is your cycle, so during that time, if you don't see your menses, you should not be scared, because you already know that my cycle is 35 days. So this month can pass and you don't see it. It is very, very okay. But if you have not calculated your cycle, you see that you'll be scared and you're afraid that you're pregnant when you are not pregnant. So it is very important you calculate your cycle and you know your cycle. Then it's okay sometimes to miss your period for 1 or 2 days, because there's a lot of things which can prolong your menses. Stress, we know nowadays there's a lot of things, the infections, COVID-19, political crisis, every now and then you can be faced in a lot of stress, or even children around the house, or many things something can stress you. Exercise, all these can prolong your menses for some few days. So if you prolong it for 1, 2 or 3 days, it is very okay. Then normally, is it okay to flow for 7 days? Yes, you can flow from 2 days to 7 days. It's a normal phenomenon. You can flow for those normal days, and especially if it is normal for all your menses, there's no need for you to panic. But if it starts increasing, or you were flowing before for 5 days and now you start flowing for 7 days, you should start getting worried. If your menses is always coming out light and it starts coming heavy, or it starts coming out in lumps, this one you should consult. If your menses is always coming out clean and with no odor, now you start having smells or associated with some discharges, you should consult. So if this was helpful, we hope that this has really helped you a lot and you have learned something. And if you have any questions, you can tell us after. And this is Pregnancy and Women Health Matters on Ablaze TV. I am Dr. Noella, founder of Talk Pregnancy with Dr. Noella, which deals with pregnancy and adolescent health, sexual and reproductive health in adolescents. You can catch me on all social media platforms: Twitter, Facebook, YouTube, and Instagram. Thank you very much, and God bless you.